Hi guys. As I was saying in previous videos, I have been out enjoying the beautiful weather, so haven't been filming as much, and also I was taking a break from social media, so I kind of felt like a bit of a hypocrite if I said, "Oh, how toxic social media can be," and then how you need to take a break, and yet I'm posting every minute of the day. But at the same time, right? So I have found that this platform is a very good one. And a massive thank you to everyone who's helped me get to 400 subscribers. So we're only 100 away from getting monetized, which is great. And massive thank you to everybody who has helped me out so far, getting to where I've gotten to. Um, yeah, it's been a difficult couple of weeks now, I have to admit. It's been hard for motivation. I've been trying to stay busy and keep active, and that's the hardest part. I think it's when you actually are trying to stay busy and it just, I don't know, the bad feelings keep persisting. The tea helps. um, no, it is. It's hard, because you're trying to find your dream job and all that career best advice and all that stuff and how to be productive. And I was fixing the side gate today, and that was fun. Fucking cut my hands up to bits. Managed to hit my finger with the hammer. My brother was holding it, and the thing slipped, and then as I was trying to hammer in one of the nails, it slipped, and then fucking hammer hit my finger, and that was a lot of fun. Yeah. So I don't know if you can see it here. Yeah, it's not too bad now, but it was worse. The door slipped, and then the hinge fell and knocked into my hand. My hand fell, and then the hammer went into my finger. But a lot of fun. It's just eventually I knew the motivation for the YouTube channel would kind of slow down a little, and then I'd have to build it up again. But the point that I'm making is that I'm trying to stay active, and I've been swimming nearly every day. Sometimes the motivation's so hard to find that I literally wait till the evening. And if anyone can relate to this, let me know. It's just you're struggling for so much motivation that eventually you say, "Fuck it, I'm just gonna go," and you just get your stuff and you go. Me and my brother go. We bring the dog on a walk, and it makes me feel good. But that inner motivation just is not there. And then I feel like something positive can come from this state of being, and that is that I'm going to do the autism overlap series. I'm going to keep going with that. It was an interesting one with borderline, emotionally unstable personality disorder. That gets me a bit emotional, so apologies for that. It was a good one. It was a deep dive. And today we're going to do one that I find very interesting, and one that I can definitely relate to, and it affects 85% of people with autism. I want to give a massive shout out to Ryan Kelly. I left a comment on his channel. He's a fellow I've been following for a while, an Australian autistic guy, and I love his channel. And he's very outgoing and does a good interview with an Australian female footballer and soccer player that is for the Wallaroos. But she was very good, and I could relate to a lot of what she was saying because she loved sport, but it was just so hard being around big crowds and socializing and everything else that goes with playing a professional sport. So massive shout out to her. And what I'm going to be talking about today is alexithymia. So I'm going to share my screen with you now and get into it. This is a condition, as I say, that affects roughly 85% of people with autism to one degree or another. And it's also known as emotional blindness. So just going to get myself set up, going to get myself ready, and then just going to pause it for a sec while I do that. We're back. So, as I always do, I love my Venn diagrams, and it just helps people visualize and learn from them. And I hope you guys learn something from this as well. But just to give you a definition of what alexithymia is, I'm just going to read it here. So, Alexithymia, also called emotional blindness, is a neuropsychological phenomenon characterized by significant challenges in recognizing, expressing, feeling, sourcing, and describing one's emotions. It is associated with difficulties in attachment and interpersonal relations, also known as emotional blindness. And then the DSM 5, what that says is that alexithymia is not officially recognized as a mental disorder in DSM-5 Diagnostic and Statistical Manual of Mental Health Disorders. While it's a significant personality trait associated with difficulty recognizing and describing emotions, it is not listed as a diagnosis within the DSM-5. Okay, so it's not actually recognized as an actual diagnosis within the Diagnostic and Statistical Manual, 5th edition, but rather it is a subset of conditions. So if I want to say it like that, it's usually associated with another condition, as a byproduct. So autism being one, and it says here, I said 85%. This reckons that it's 40 to 65%, and this is from Squarespace again, a really good app, and I'm not doing advertisements for them, just FYI. But yeah, so it's usually associated with another condition, autism being quite a common one, and also borderline. I heard was another one where alexithymia can be quite common, and avoidant personality disorder, which I'm going to get into as well, AVPD, because that causes quite a lot of confusion. It's quite commonly mistaken for autism, but it can also coexist with autism. So, yeah, there's a lot going on there. And psychology is definitely a messy field. It's not an exact science. And I've heard psychiatrists and psychologists admit to that, because this brain of ours is such a wonderful and yet complex organ. Alexithymia is a funny one, but basically what it means to me is you have difficulty. Well, it says it right here, difficulty identifying emotions, but what does that even mean? It's kind of like, what am I feeling? Can I put it into words? I don't really know, and it can cause a lot of distress. What I've heard of people talking about it. I've also seen people who are misdiagnosed with antisocial personality disorder, which has quite a negative connotation because it's associated with violence, deceptive behavior. But the big thing is like the lack of empathy. And I don't think necessarily that there's a lack of empathy. It's just that it's difficult to express the empathy in the right way. Which is the same with autism. Like I was told, oh, I'd have a lack of empathy and all, whereas I'm quite an empathetic person. And I've met a lot of people that are autistic that are very empathetic, and we're not identifying as dark empaths or whatever. I'm just saying, from what I've seen and observed, they show a lot of empathy and concern towards me. In fact, the only people they don't show empathy towards is themselves, and I can identify with that 100%. Um, yeah, there's certain things that I can relate to with this. Now, a lot of it could be explained with autism, but we'll go into it now, and you can say whether or not you identify with any of the symptoms, and then obviously we'll touch on the overlap, which is what this is about. But difficulty differentiating between feelings and bodily sensations. Um, yeah, so a lot of it is quite ironically, it's difficult to describe. um, yeah, I actually think there's a good way of describing this now. So I'll be at the beach, right, with my family, and when I was younger, I always used to hate going to the beach, but I always loved it and had a great time when I was there. But it was difficult for me to kind of be content, and have that feeling. I was like, am I content or am I anxious? And do I want to leave or do I want to stay? It was very hard for me to decide whether to stay or whether to leave because it was time to go. Am I enjoying myself or am I not? Not knowing that is quite challenging. If I'm trying to relate to this. And like that's the thing, it's not actually recognized as an official condition. So I doubt that a doctor would diagnose you with it. Because how are they going to? what are they going to use to diagnose you? Do you know what I mean? The DSM-5 doesn't recognize it anyway. So, but yeah, like you can kind of feel comfort, but then do you feel it, and then does your body tell you something else? My mind's telling me no, but my body is telling me yeah. There's always a song for every occasion, as my mum would always say. Um, and then she never stops singing. Luckily, Alfie sings and stops her from taking over the spotlight. Yeah, difficulty describing emotions would be something now. This one's kind of hard to put into words, you know. Um, yeah, like feelings, I guess, are you uncomfortable with your feelings and your emotions? And then is that a physical sensation or is it a mental thing as well? It's kind of hard to differentiate, you know? Yeah, sometimes like difficulty describing emotions. How are you feeling? I don't really know. I'm just, I guess if you're in discomfort, it's kind of like, and you can't put that into words, that can be quite challenging, you know? Which would give you a lot of frustration, I'd imagine. Detached, avoidant, attachment style. Detached, avoidant, attachment style. Interesting choice of words. I feel like they've used very difficult words here for describing a difficult thing, which probably makes sense in fairness. Yeah, so when you hear avoidant, I think again of avoidant personality disorder, which I was talking about just a few seconds ago. Uh, and that's kind of difficulty with committing yourself to other people. So with avoidant personality disorder, which I'm definitely going to touch on, what you would have is people who feel inferior a lot of the time, you know, so they're afraid to put themselves out in social gatherings and they're afraid of judgment. And it's understandable, you know, they feel inferior. So why would you want to go out in front of a lot of people where you feel like you're going to be judged, especially like, you know, office stews and business meetings and all that sort of thing? Be quite difficult, I would say. Um, and I guess you're not going to get all these real loving emotions that you might expect. You know, you're going to get someone who's quite flat and might seem uninterested, but they just don't know what they're supposed to express. With alexithymia, and I can relate to that. It's almost like, am I supposed to feel a particular way? What do people expect me to show? So I've gotten quite good at faking it, you know. At least I think I have anyway. But I would normally have had quite a flat affect when I was younger, especially where everybody else is getting really excited and bubbly, and I'm just kind of like, oh yeah, yeah, you know, I'm like, am I supposed to get emotional for this? Am I supposed to get agitated? Or I would have had quite flat emotions, and then obviously sometimes the complete opposite, you know. But it's kind of funny how borderline can have alexithymia as well, you know, because you normally associate that with quite explosive emotions. So it's an interesting one. Externally oriented thinking. Um, so I would imagine with that, you're kind of not in the moment. So someone's trying to talk to you and you're daydreaming. Daydreaming is what comes into my mind. And there is a song for that. A song by Lupe Fiasco. Daydreaming. Fell asleep beneath the flowers for a couple of hours. What a beautiful day. That song always put me to sleep. It's such a calm and a relaxing song. Daydreaming was also quite relaxing for me. Yeah, or I guess externally would be thinking of things apart from yourself, outside of yourself, because it's quite uncomfortable being within yourself. Um, yeah, that's an interesting one. It's kind of hard, ironically, to put all these terms into words, but it's a difficult thing to put into words. Like that's the whole point of it, you know, emotional blindness, difficulty expressing and describing your emotions. What are you feeling? I don't fucking know. Reduced effective empathy. So someone like this is I know exactly what this one is. Someone might give you really bad news, you know what I mean? Like, oh, my cat's died, and you're kind of like they're crying and bawling, and you might be kind of like, Okay, what kind of cat was it? That can look quite psychopathic and lacking in empathy, but I guess it's not being able to realize what's the appropriate response. And in my earlier days of autism, I would have definitely been more like that. I would have been like, okay, how am I supposed to respond to this? Um, and also, weirdly enough, I've seen people give, proper examples of alexithymia, and I related to it a lot, where someone will get offended by something you've said, and you're kind of like, what did I say? But it's the way you say it, it feels like it's quite condescending or cutting, and you're like, no, I didn't mean it like that, So yeah, it's a hard one to describe, but I guess people can take you up the wrong way. Like they can say something expecting empathy, and a lot of people do say something and they want you to feel sorry for them. They say, "Oh my God, I'm so fat and distressed," let's say, or just to give you an example, and then you might go, "Ah, yeah, yeah, it does make you look a bit overweight." And you're like, "Oh my God, how could you say that to me?" And it's like, I'm just agreeing with you. Now, obviously, I know that that's obviously that's wrong. I know that, but you know, most people know instinctively, at least neurotypical people know instinctively that if a man and his girlfriend, for instance, let's give a good example, if his girlfriend says, "Does my bum look big in this?" and if he says yes, she's like, "Oh my God, no, I like a big bum, so I don't mind." That'd be a compliment on my part. I saw a really funny one, an Australian ad where there was a really good looking Australian girl and their boyfriend, and she says, "Does my bum look big in this?" And he goes, "Yeah, but it takes away the the attention from your face." Oh, that was brilliant. He's like, yeah, basically you're ugly, so at least it takes the attention off your face. She wasn't ugly, by the way. She was stunning, but you get the point. I thought that was hilarious, but you kind of you kind of know, like it's second nature to me now. I know that if your girlfriend says, "Do I look fat in this?" you're supposed to say no. I know that, but before I would have been quite blunt and I would have been like, oh, just honest how I felt. And unfortunately, honesty isn't always appreciated. So, like, as well, I've got Dutch family, and Dutch people are known to be extremely direct and tell you, they say, if you want an honest answer, ask a Dutch person. But if you want people to flatter you, don't speak to a Dutch person. Even more so than Germans, like, they're just so direct and they'll give you it straight. So, they'll give you an honest answer at least. So, if you see Vander or any name with Van in it or the clerk or something, don't ask them because they'll give you a straight answer. And if you don't want the truth, as Jack Nicholson would say, you can't handle the truth. Do not ask a Dutch person. So yeah, emotional blindness, quite flat affect and quite numb emotionally. But it can be quite frustrating, I'd imagine, if you can't describe your emotions. You're thinking externally quite a bit, difficulty registering emotions as well. So you should feel sad about something. And weirdly enough, with me, sometimes in the moment, like when my granny Judy died, God rest her soul, I didn't feel sad when it happened initially, and then after her funeral, it started registering with me. So I would say that's how that one relates to me. Sometimes it took a while for the emotions to kick in, but when they did, it was bad all the same. Um, And if you combine that with autism, so we've already talked about it quite a bit, special interests, of course, so fixating on stuff, difficulties in emotional recognition and empathy not observed in research studies, autism with no alexithymia, just FYI. So it can happen without any of this. You don't need alexithymia to have difficulties in emotional recognition and empathy. But that's just how neurotypical people perceive empathy. So, as I say, I don't buy the whole notion that autistic people have less empathy. I think they've got more. There's so much, in fact, that I feel like it's painful because the way we see the world is why are there so many injustices? It shouldn't be like this. And we're not able to put on a mask and pretend like everything's hunky dory and be ignorant. We see it for what it is, I think. And that's extremely painful because it's quite a cruel place in a lot of ways. I find that anyway, and I find it, especially now, we're seeing a lot of negative shit. There's always been negative stuff going on, but now it's just amplified. Um, and as if, the whole thing with Russia, Ukraine, and Israel and Palestine wasn't bad enough. Now Pakistan and India are getting into it as well. So it's looking quite dangerous at the moment. But yeah, let's get back to the topic at hand. High context, visual thinker, literal use of words. So remember, like I was talking about with Dutch people, be quite literal and ironically, like someone's gonna laugh because they gave me a great example, but I was talking about the Dark Knight Rises, Batman and Bane, "Oh, you came to die with your people, not of your body, of your soul. Harvey Dent. That fucking mask. So many people doing Joker and Bane impressions. Not of your body, of your soul. But Batman had a very autistic moment in that Christian Bale's Batman, the only Batman that there ever will be. He is Batman for me. But when Bane says to Batman after he escapes from the hole in the ground, that, the big prison, he says, "Ah, Mr. Wayne, you came to die with your people." And he goes, "No, I came to stop you." And you're going like, yeah, no shit. And I was just there joking with the lad who was saying it to me. I was there kind of going, autistic Batman. And Batman, like very obvious. Like if I feel like in Ireland you have to get good at sarcasm or you're not gonna survive. Like if I get any food down my front when I'm eating my dinner, my mom will say to me instantly, without question, "Jason, did you get any of that in your mouth?" And you'll be there like, "Oh, I only spilled a bit of it down my front, but I ate the rest." And sometimes I'll look like I'm being quite defensive, but I can't just switch it off. Sometimes it's just there, and my answer will be, "Oh, but I did this," and I'll get kind of offended by it. I'm offended, but quite literal thinking. Difficulty with NT, social communication patterns. NT, I'm just going to see what NT is. Yeah, NT, social communication. Here we are. Neurotypical. That's what I thought it meant. Just wanted to be sure. I don't know why you can't put neurotypical. Everything's abbreviated now, and it drives me insane. Yeah, neurotypical. Very good. All right then. Yeah, self-soothes through repetitive behaviors, routines, and stimming. Stimming, like I talked about my haka thing that I used to do because I always loved rugby and there was a rugby team doing their haka and then grinding my teeth like that and that sort of thing. But yeah, I'm going to start at the bottom and I'm going to finish off with this one because ROACE, because that's an interesting one. But interoception struggles. There's a lot of confusing dialogue here. So actually, I might start at the top, because I have the definition right here, of ROACE, because I feel like that's one that can be quite confusing, and there's a lot of confusing terminology. But ROACE is basically a term that stands for aromantic asexual, and it describes the individual who experiences little to no romantic or sexual attraction. It's a combination of two identities: aromantic, meaning someone who doesn't feel romantic attraction, and asexual, someone who doesn't feel sexual attraction. So then aromantic, um, aromanticism refers to the lack of romantic attraction to others. While some aromantics may not feel romantic attraction, they may still experience other forms of attraction, like platonic or aesthetic attraction. So if someone looks attractive, do you know what I mean? Like a good looking woman, platonic attraction. Now that's a funny one now, but I'm gonna look that up as well. But if we get into asexuality, I think that you kind of know what that means. But for anyone who doesn't, I'll go through the definition. It refers to the lack of sexual attraction to others. So no sexual attraction to other people at all. Asexual individuals may still experience other forms of attraction, including romantic attraction. So I feel like, you might like a person and want a romantic relationship, but sexual attraction is not there. So imagine the two combined, it could be quite a dull and nasty place to be. Then again, if you can't use emotions, sexual attraction, loving someone is quite an emotional thing. So then we get to arrow ace. And I feel like it's good that they have the two kind of separated with capital A's, AA, and then we've got AA for alexithymia and autism. um, Arrow ace. The term arrow ace is a combination of both aromantic and asexual, signifying an individual who experiences little to no romantic or sexual attraction. So relationships are quite null and void, essentially. Arrow ace individuals may not feel the need to engage in sexual or romantic relationships. They may still experience other forms of attraction, such as platonic, aesthetic, or queer platonic attraction. Whatever the fuck that is, I'm going to definitely have to look that up. Okay. Asexuality and aromanticism exist on a spectrum, and aro ace individuals may fall anywhere on that spectrum, according to RCSGD, whatever that is. There's just a Reddit thing underneath going, what is an aro ace lesbian? I'm confused. You're not alone. I'm very confused too. So I'm going to look up platonic attraction. This is an interesting video, isn't it? Platonic attraction refers to a deep emotional connection and desire for a close, non romantic friendship with someone. It's a close form of attraction where you want to be close to, enjoy being around, and deeply connect with someone without any sexual or romantic interest. This attraction can be mistaken for romantic attraction by those who don't experience it in the same way. Gotcha. Okay. And key characteristics, because I feel like this will really help you just understand it a bit better. So, key characteristics of platonic attraction: deep connection, strong desire to form a close, meaningful friendship, emotional intimacy, a willingness to share personal thoughts and feelings with the person, no romantic or sexual desire, lack of sexual attraction or desire for a romantic relationship. Can be mistaken for romantic attraction, though. So some people may experience strong platonic attraction, which can be confused with romantic feelings, not limited to a specific gender. So, it can be anyone, it can be the opposite sex of the same sex, or whatever, how many there are nowadays. Platonic attraction can exist between people of the opposite or same gender. Okay, gotcha. Yeah, very good. Um, Distinguishing platonic attraction from romantic attraction. This will probably be a good one now. While both involve a deep connection and strong feelings, romantic attraction includes a desire for physical intimacy, romantic relationships, and sexual desire. Romantic, now, this is. And then we get to platonic attraction. On the other hand, focuses on a deep friendship and emotional connection without these components. Examples: a close friend who you deeply care about and enjoy spending time with, but have no romantic feelings for whatsoever. Just a very good friend, but you don't have any desire to sleep with them, essentially. Feeling a strong desire to be in a supportive and nurturing relationship with someone without any sexual or romantic desires. Having a strong bond with a person and wanting to share life's joys and challenges with them, but without a romantic or sexual connection. There's even a flag for to show you the flag there, if you can see it. Okay, it's not really coming up. It's orange, pink, yellow, and kind of creamy colored. Okay, interesting. So that's a funny one. Yeah, very interesting indeed. So it's like you really care for a person, but you don't see them as a sexual partner. And if you've got all these things going on, it would be very hard for you to even imagine or, fathom the idea of having a sexual partner because, not to put it too bluntly, but how do you get sexually aroused if you can't even feel emotions? If I'm really attracted to someone and I love them, then yeah, like you can read between the lines, can't you? But you can't even get aroused if you struggle to have any emotion, but you like the person and you want that person around, but you just can't force any of these things. So I can't be very emotional and force it. I've gotten very good at forcing and pretending, but that wouldn't be my natural state, and I feel like I've gotten to a point where I don't really know who I am because I'm trying to force that, which gets us in nicely to higher prevalence of relationship and sexual struggles. So I find it difficult to be intimate with someone, very difficult. And even if I'm sexually attracted to the person, I kind of get afraid of, oh, I'm getting in too deep here. And I feel like I have to be distant from the person. It's like sexual attraction versus relationships have to be different. Like what they were saying there, it's an intellectual type of relationship, not physical or sexual. You know what I mean? But then, and here's the caveat to this, as a young lad in an all boys school, all they're ever talking about is shagging. So, did you get with a girl? And what did you get from her? You know, that's just how it goes, unfortunately. Um, that's all they talk about, So I felt like there was this pressure to keep up with everyone, but I didn't have the same desire or urges that they had. I always wanted a more deep and meaningful connection. You know what I mean? And I've heard autistic people say that. Now they say they're sexually aroused by their partner, but it's not this blossoming, love, 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 shagging every minute of the day um, type of relationship. But it's also the reason why I'm very anxious about ever going back on SSRIs, selective serotonin reuptake inhibitors. Got it. Antidepressants, because if I do meet someone I like, how embarrassing is it when you can't perform? You know what I mean? So you don't want to be like that. I get in such low moods that it's hard for me to get aroused at times, and yeah, I imagine it'd be quite difficult for a romantic relationship. So at least I have some level of love and capacity for feeling love, and but I've never had a long term relationship because I'm quite flat. Sometimes it's difficult for me to keep up the show. Eventually, the mask does drop, unfortunately, and I don't want someone to feel like they have to be with me, and at the same time, I would like to show the person that I love them, um, without this numbing and dull emotional state. You know what I mean? I'd like to be able to express all the love and tell them how much I love them. Um, Sometimes, though, I can be quite flat. My affect is saying otherwise, and people might get the impression that I don't like them, but that's not the case at all. And then obviously everything feeds into each other, and if you can't connect, increased rates of depression and anxiety. I mean, that makes sense, doesn't it? You can't connect with others, and us human beings were hardwired for connection, as they always say. So it can be quite alienating, I would imagine. You don't want to stick out from the crowd, but you are going to if you're the one that can't connect and everybody else is, and everybody else is forming relationships. And not only that, everybody else has had relationships since they were, 13 or 14 in some cases. I only really start getting interested in the opposite sex at around 15 or 16, never mind being in, I mean, it's puppy love, isn't it? It's not a proper relationship. It's quite cringy stuff when people say that, isn't it? Oh yeah, my first girlfriend at 12, sometimes 10. We kissed in the playground. more difficulty regulating emotions. I would imagine so, because you don't know which ones are coming or going, which ones to express and which ones to hide. Do you even know what to call them, or can you put your finger on it? If you can't do that, I imagine it would be quite difficult to regulate your emotions. Increased rates of eating disorders. Yeah, so some people look forward to a meal. They have a desire to make a big, delicious meal. Sometimes with me, I don't care, and I feel stuffed. I feel numb. No desire to make a nice meal, or as I talked about in great detail, but starving myself and wanting to be thin, then just having no desire to eat, then having the desire to eat too much, and man, it was messy, very messy indeed. But yeah, I can definitely say yes, this and this substance abuse. If you feel numb and like that, if you have a void, you're going to look to fill it, be that with food or alcohol, drugs, whatever. It's only natural, isn't it? I can definitely relate to that. If there's a big void in there and you feel apathy, you feel like you should care and you want to care. That's the thing. You want to give a shit about stuff, but you just can't. Um, I was talking about that a good bit with autism and depression. But depression is a different thing. It's this alexithymia here that gives you that sense of not giving a fuck about anything. So you want to care, but you just can't. Um, and then you're isolated, you're numb, and you can see other people are clearly picking up on stuff that you're just not. They're able to connect, and you want that, you desire that. I definitely do anyway. I don't know about everyone, but I can certainly speak for myself saying I've always wanted that connection, but it's just been very difficult for me to pick up on stuff. And so I spent a lot of time daydreaming and fantasizing about the time where I'd finally be able to, or, pretending I was somebody else who could do all those things. But as you get older, the reality hits you that, oh, that's not me. You know what I mean? And yeah, it's quite a shitty place to be, where you're not hitting milestones the same rate that everybody else is. And then you feel like you've let your parents down because why couldn't they have had a normal kid? And it is hard, but don't despair. You're not alone. And there are plenty of people out there, believe me, who feel the same way. I know I'm fucking one of them. Then here's the one now, interoception struggles. So let's have a look at that now and see what that means. There's a few terms here that some I've heard, some I haven't. Interoception. All right, so interoception is an internal sensory system that allows individuals to perceive and understand the physiological state of their body. It involves noticing and recognizing internal sensations such as hunger, pain, heart rate, and emotional states, as well as responding to these signals. Right, okay. Key aspects to interoception. Internal sensory system. Interoception is a sense that enables individuals to be aware of what's happening inside their body, including internal organs, muscles, and tissue. Awareness and recognition. It involves noticing and identifying internal sensations, such as the growling of the stomach or a racing heart, anxiety. Response to signals. Interoception helps individuals understand their internal state and respond accordingly, such as eating when hungry or taking deep breaths when feeling anxious. Impact on well being. Interoception plays a crucial role in self regulation, mental health, and social connection. Emotional and physical health. Interoception can impact how individuals experience and express emotions, and also how they respond to physical sensations like pain or hunger. So here's an example of just interoceptive awareness. Hunger, feeling a growling stomach or a pulling sensation in the abdomen, which indicates a need for food. Thirst, recognizing a dry feeling in the mouth or throat as a signal to drink water. Anxiety, sensing a racing heart or increased heart rate when feeling stressed. Pain, recognizing the location and intensity of pain, which can be helpful in understanding and managing the condition. Importance of interoception. Self regulation. Interoception helps individuals manage their internal state and respond to bodily needs, such as eating, drinking, or seeking rest. Emotional awareness. It helps individuals understand and respond to their emotions, which can impact behavior and mental health. Physical health. Interoception plays a vital role in regulating vital functions like body temperature, hunger, and thirst, as well as responding to pain and discomfort. Okay, so it's basically like a mind and body connection. You know, I've got a dry mouth, which I do right now, and I'm going to take a sip of water. Be a key example of that. So if you're struggling with that, you might get a dry mouth, but not go, I need to drink water. Sometimes with me, like you'll see other people thinking it's raining, take cover, whereas I'll just be standing there getting wet and kind of sometimes be so zen and just daydreaming. I fell asleep. And I'll just sit there. I won't really mind that I'm getting wet. And then people will be like, oh, are you wet? And I'm like, oh, no. And then I'm like, you are, you're soaked. Get in out of the rain. And in Ireland, we have a big problem with rain, considering we get a lot of it. But yeah, like you get that growling in your stomach. Like sometimes I'll feel stuffed in the mornings and I'll have breakfast and I'll just be stuffed for, the next few hours. And then all of a sudden, bang, I'll be starving and I'll need to lob the food into me. It's not easy to, eat the same way every day because sometimes I get starving and other times I feel stuffed for 5 hours. Next thing it hits me and I have to eat something. So that's when you can reach for the highly palatable carbs, the shitty carbs like crisps and sweets and all that. I'm actually doing really well. So for the last 2 weeks, I've been trying to give up fizzy drinks and I've been doing an all right job. 3 weeks now, and I've had 2 cans of Coke Zero and I've had 1 can of full sugar Coke in that time. And then I had a Coke with my Burger King. Actually, me and my brother went for a Burger King last Monday, so guilty. But yeah, I've been doing better, and had me feeling a bit low in energy, but I have to say, not too bad. So I'm hoping to keep that going because fizzy drinks are very bad for you, but I absolutely love them all the same. They've always been my kryptonite, as has food. But yeah, guys, like you can imagine, if you can't identify how you're feeling, you're not very sure of yourself, and you might offend people, but go, how the hell did I offend them? What did I do? What did I say? But people are very easily offended nowadays. I've often offended people and been like, what the hell did I say? I didn't mean to offend in any way. You might think you're being funny or it's just humor because you think it's appropriate to say a joke because you've heard other people say it. And a lot of people have double standards. So I guess you just pick the wrong people on the wrong day. But yeah, it's a difficult one to describe, but I feel like it's a good place to leave it, guys. It's basically autism and then a condition called alexithymia, also known as emotional blindness. Maybe quite a difficult condition to live with. Usually goes hand in hand. So just see. I'm actually just going to finish off by looking up alexithymia. Um, and what conditions it usually is overlapped with. Yeah, so it's usually autism. Very, it's overwhelmingly associated with autism. Other conditions, OCD, so obsessive compulsive disorder, ADHD, attention deficit hyperactive disorder, and PTSD, post traumatic stress disorder. And that would make sense. You just can't express your emotions because you're in such a traumatic state. So just to summarize, the conditions it's most likely to co-occur with are autism spectrum disorder, attention deficit hyperactive disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Depression as well. As you can imagine, if you're quite flat and feeling miserable and everything's numb, you get quite a lot of difficulty expressing your emotions, you know. And then a lot we've talked about already. Yeah. Okay. Yeah, just to give you an idea, guys, because I feel like that was actually a lot more interesting for me than I thought it was going to be. I didn't know if I was going to be able to have a full discussion because there are a lot of difficult terms used with this, but it most commonly occurs in autism and be quite difficult, as you can imagine. Like if you can put yourself in someone's shoes who can't express emotions or love or can't really maintain friendships or has difficulty with sexual partners and just feels a void and an emptiness, you know? Um, these people deserve our empathy. And people with autism, like myself, experience this to varying degrees. So I can definitely relate to a lot of what I've heard people describe it as. And fair play to them for describing it because if you've difficulty identifying your emotions and describing them, good job managing to somehow do that for other people. So fair play. Um, so guys, we'll leave it on that, and I hope that was helpful to you. Let me know what you think, and a massive thanks for everyone who's helped me get to 400 subscribers. Let's keep it going. We're gonna end on that note, guys. Slán go fóill.